Let's say you're a clinical psychologist who's able to prescribe medications. You're seeing a patient for the first time who has been an alcoholic for 20 years and is now battling with depression. This patient has come to see you for help and to receive medication. So since they're battling with depression, you order your patient Prozac. Prozac will help for the depression along with therapy. But then a week later, you get a phone call from the hospital saying that your patient who was prescribed Prozac from you now has cirrhosis of the liver, which means a damaged liver. A mixture between the Prozac, which one of the side effects is cirrhosis of the liver, and the mixture of the alcoholism has basically shot your patient's liver. Because of your misdiagnosis, this is one of the reasons why psychiatrists don't believe that psychologists should be able to prescribe medications. But there has been a battle between psychologists and psychiatrists of them, or psychologists being able to prescribe medications. There are 2 states in the United States that do allow psychologists to prescribe medications. This includes Louisiana and New Mexico, along with psychologists who are on military bases, who help out soldiers. Now let's go over the different background between psychologists and the psychiatrists and their roles in education. According to Muse and McGrath, psychologists go to school for 4 years and receive their PhD or PsyD. Some of their certain roles include therapy, assessments, teaching, and research. But we're mainly going to talk about therapy with clinical psychologists. Now with psychiatrists, they go through a little more extensive education, according to Muse and McGrath. They go through 4 years of schooling and then an extra 4 years of residency in a hospital. And then, right after that, they are able to decide if they want to become a psychiatrist or any other type of MD. Psychiatrists receive an MD just like your regular primary care or even surgeons do. So their education is a lot more extensive. Dr. Mendava says that prescribing medicine is not just, oh, you have depression and here's some Prozac. You have to learn how medicines interact with the body and different diseases. So it's much more than just, here's Prozac for your depression, which is a huge hit for a psychologist because they don't receive that extensive training. So now let's go a little more over the views for psychologists and psychiatrists on prescribing medications. Obviously we know psychiatrists don't really think that psychologists should, but some psychiatrists do, including Dr. Mendava. Dr. Mendava says, hey, if they receive the proper training like we do, why not let them? It could be good for them. This is what Dr. Danae Hudson, a therapist down in Springfield, Missouri, and Dr. Rachel Harrington, also a therapist, they say, if, as long as they receive the proper training, then let's prescribe medications. But if we don't receive the proper training, I don't think that we should be able to. So now that we've gone over the certain roles and the training, now let's go over reasons why it would be a good thing of why psychologists should be able to prescribe medicine. As we know, most therapists will do sessions between 50 minutes and 1 hour. According to Dr. Rachel Harrington, these 50-minute sessions, along with being able to prescribe medications, will enhance the outcome for patients because you'll be able to see their outcome a little more better and be able to monitor the progression. Walker believes it would eliminate the lack of communication between psychologists and psychiatrists. If a patient is seeing a psychiatrist just specifically for the medication, but then a psychologist for their therapy, it's very hard for a psychiatrist and psychologist who are very busy and who see a lot of patients in one day to communicate on their progression. So seeing just a psychologist who does therapy and being able to prescribe medicine will eliminate that lack of communication. Because if they are not reacting to the therapy or the medicine very well, then they're going to have to change something up. According to Dr. Hudson, she says that it won't take as long to receive their medications. For any people out there who have seen a psychiatrist, it usually does take 3 to 6 months to see their psychiatrist. But with a psychologist, you usually see them at least once a week or once every 2 weeks. So you'll be able to see them a lot more. So to go over why psychologists should be able to prescribe medications, it will eliminate the lack of communication. It will enhance the progression and being able to monitor patients' progression. And it will take away from the amount of time that it will take to get the certain refills.